right, we might get started. Welcome, everyone. MoreGoodDays acknowledges the traditional custodians of country throughout Australia and the connections to land, sea and community. We pay our respects to their elders, past, present and emerging, and we extend that respect to all Aboriginal and Torres Strait Islanders peoples today. Welcome, everyone. I'm Sonia. I'm one of the support coaches here at MoreGoodDays. I was diagnosed with fibromyalgia in 2012, and I did the MoreGoodDays pain management program in 2022. And last year, I joined the team as a support coach in January. We are a pain management program specifically designed for people with fibromyalgia. It's a research-backed, neuroscience and psychology-based online program that helps you learn the tools and strategies to help better manage your pain and the other symptoms that do come with fibromyalgia. We know that management of this kind of condition takes a multidisciplinary approach, and we do aim to cover a variety of topics. One of those topics is movement and exercise. It's a really important part of managing a chronic illness, especially one like fibromyalgia, but it can be a really tricky thing to navigate when you have pain and fatigue and so many other symptoms and trying to find the right sort of thing. So that's why today's topic is on movement and exercise. Just before we go any further, I would just like to remind everyone that the session is recorded and that your presence today indicates that you accept the rules that were in the invitation, and particularly that no expletives or hate speech of any kind will be tolerated. Please keep your microphone muted during the presentation. If we have time at the end, we will open the chat for people to ask questions verbally, but otherwise, please use the chat function. If you'd like your question to be asked anonymously or without identifying you, just hit the little arrow next to the everyone where it says everyone in the chat and change that to me, to MoreGoodDays, and I'll be the only one that sees it then. If we don't have time to address all of the questions, we'll make a note of them and hopefully address them in a future session. I would like to welcome Milos Stojanovic, and he is a persistent pain physiotherapist. He has a Bachelor of Sports Science and a doctorate of physiotherapy. He's passionate about helping chronic pain patients regain physical function and strength aligned to their personal life-directed goals. He draws upon more than 10 years of clinical experience and is really skilled at handling complex chronic pain cases. And he tailors that treatment to the individual's needs, their goals and capacities. He's trained in the latest evidence-based therapeutic pain education and integrates a biopsychosocial model of pain management into treatment. Today, Milos will be speaking with us about the importance of movement in general and specifically for chronic pain. Afterwards, we will address some of the questions that were submitted in advance and maybe some of the ones that will be submitted during the chat. We'll just have to see how we go for time though. Welcome, Milos, and thank you very much for joining us today.
Thank you, Sonia, for such a lovely introduction. And thank you everyone for joining in on today's webinar. So I've got a preparation. I've prepared a PowerPoint presentation, which I'll be sharing with everyone today. Let me just share that. I think that's come through. Sonia, are we good with the PowerPoint?
Good to go.
Yep. Okay, awesome. So once again, my name is Milos. I have a Bachelor of Exercise Science and a doctorate in physiotherapy, and I have a passion in managing complex chronic pain presentations, specifically fibromyalgia, but not limited to. So I've been an active physio for over 5 years, and basically my initial passions started when I experienced an injury that led to chronic pain in my early 20s. And that sort of led me down the path to further understand and learn about chronic pain. And now I'm here to share everything that I've sort of been able to learn along my journey with the world and hopefully help as many people as I possibly can. So today we're going to be talking about the basics of persistent pain. We're going to get into basically how we feel pain, how pain works, and understanding pain. And then I'm going to take you through a little bit of a case study with a patient of mine that I've been working with for about 12 months and sort of go through some of the things that we went through in clinic and discuss outcomes. And after that, we can go through some of the questions that have been submitted, and hopefully I cover the majority of them throughout the presentations. But if I don't, we can delve a little bit deeper into them towards the end of the presentation. So if you have any questions, please feel free to submit them in chat. Let's begin. So what is pain? So I like to always start off my pain presentations with the actual definition of pain. And pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. So it's not just the sensory experience, but the key take home with this definition that it can be an emotional experience, it can be actual damage, or the potential of tissue damage that can all play a part in pain. So it's generally categorized in two parts. So we have acute pain and we have chronic pain. And there's a couple of different characteristics that define acute versus chronic pain. Acute pain is new onset that's associated with an injury. It's useful as it's a protective mechanism. So it protects you from creating more harm or more damage. It's generally short-lived. And generally specific treatments that target that injured area are very effective. And acute pain is generally the pain that we feel between 0 and 3 months. Once pain exceeds a 3-month time frame, that's when we categorize it as chronic pain. So it's persistent pain that is beyond that expected healing time. It doesn't just play a role in minimizing movement or limiting movement, but it also can impact the quality of life that we have. So it limits our life much beyond just a limited range of motion or limited movement. And there's generally a component of a hypersensitive or an oversensitive nervous system, which we'll get deeper into throughout the rest of the presentation. So why is it that beyond the 3-month mark that we classify as chronic pain? Well, what the research suggests is that majority of tissue healing occurs within the first 3 months. So if we break a bone, it heals within an 8-week time period. If we strain a ligament, it heals within a 8-week to 10-week time period. Obviously, there's specifics depending on the re-injury itself, but generally speaking, majority of injuries heal within that time frame. So hence why we classify chronic pain to be above that or beyond that 3-month mark. So what is the clinical application? So I like to talk a little bit about the difference between acute and chronic pain, mainly because firstly, there is a difference in the way that we manage it. And if we limit ourselves to managing chronic pain using the same tools or the same management structure that we use in an acute setting, it won't be as effective. And one of the main reasons is, as Sonia said, that multifactorial treatment approach, where we need to not only look at the injury itself, but other aspects of what could potentially be aggravating our persistent pain. That's where we've come up with the biopsychosocial model. So rather than just using the biomedical approach, which is looking at, okay, the bone's broken, we need to come up with a strategy to manage the bone itself, we actually look at not only the biomedical, but also the psychological, which is the psycho and the social aspect of pain, because we know now that majority of chronic pain or persistent pain sufferers have this multiple factors involved in their persistent pain. Some people have more bio, so we focus on that. Some people have more of the psychological, so we focus on that. Some people have more of the social, so we focus on that. And some people have a combination of the three. But just acknowledging that and understanding that we need to manage all key aspects to optimize persistent pain is really important. And then the not one size fits all approach. So as I mentioned, some people you want to focus more on the psychological as opposed to the social, and vice versa. So tailoring the management strategy specific to the person is really important with managing persistent pain. And I want to get into the pain neuroscience component. So how do we feel pain? Where does pain come from? What factors influencing pain? So that'll be something that we talk about before our case study. So, and the importance of that is when we understand how we feel the pain, it's actually a lot easier to manage the pain. It improves our confidence, our emotions towards the pain. It prepares us for flare-ups when we do face flare-ups. And it allows us to take a little bit more control of pain when we know and we're equipped with the knowledge on actually what's going on, what's happening in this moment. These are some studies that I referenced throughout the the presentation. So if you want, you can screenshot them, or I can send them through to you after the presentation. But basically, everything that we discuss moving forward is referenced by scientific literature. Okay, so this is the first part to understanding pain. So when I first saw this, I was quite shocked. There's a lot of information. There's a lot of processes happening, a lot of colors, but over time, it's actually quite simple to understand. So this is the clinical model of pain, and this basically illustrates how our body processes pain. And I think it's the first step to managing persistent pain is understanding where it comes from. So basically, initially, the pain signal comes at the site of injury, which is what we call nociceptive signaling or neuropathic signaling. Now, you don't need to remember any of these fancy words, but it's just the initial signal of where the injury comes from. That signal then travels up to the spinal cord. The spinal cord then sends that signal up to the brain. The brain processes that signal, and then it sends the signal back out, and that's when you feel pain. So the key take-home message here is that you don't feel pain until it's processed and sent out by the brain, which means that there can be a lot of factors that influence the signal between where you initially feel this signal to when it comes back and you feel it as pain, right? So what we're going to do today is we're going to sort of break this down and break down the three common components of what happens with the pain signal as it travels to and from the brain. So the first one is the peripheral mechanism. So when you have an initial injury, it basically gets sent to the spinal cord. The spinal cord then either dampens it, blocks it, or lets it through, right? In a lot of cases, it does block the signal. So if you can recall at any stage where you've seen, a paper cut, but you wondered where you got that paper cut, or maybe you have a bruise and you're not sure quite where you got the bruise. Basically, what happens in those particular cases is that the signal goes up to the spinal cord. The spinal cord then deems it not to be threatening, so it kind of dampens the signal, and it doesn't actually go up to the brain, and you don't really feel it. You might be distracted with something else in the moment, and the signal doesn't actually get sent back out. But when you have persistent pain, or when we've had pain for a long period of time, the signals that get through the spinal cord actually become more frequent, and the spinal cord just lets everything through. It stops dampening those signals, which means that it almost becomes more sensitive, right? The signal goes up, it just keeps getting sent through to the brain. It even begins to send signals through that are, let's say, atypical. So something like a touch or a gentle bump can send off these pain signals because the spinal cord is letting everything through. Right? Once it goes through the spinal cord, it actually goes up to the brain and it gets processed in the brain. Now, the key component, or the key factors that I wanted to talk about with the processing in the brain is that where pain gets processed is the same area of the brain that emotions get processed. So oftentimes, as the signal goes up to the spinal cord and up to the brain, it ends up in the same areas where emotions get processed. And oftentimes what can happen is they can almost intertwine with one another and affect each other. So there is an effect on the pain signal at the level of the brain before it gets sent out. And what we know now is that negative thoughts and beliefs like stress, frustration, anxiousness can actually increase the volume of pain that we feel before it gets sent out to the level where you feel it. And oftentimes, particularly with fibromyalgia, sometimes it doesn't actually get sent out to the same area, but it gets sent out to a different area because of how intertwined our central nervous system is. So that's where we have that widespread sort of pain and discomfort feeling from, because the brain can actually send it to different parts of the body as it's the nervous system is quite sensitive. And as I touched on, so when you have that initial nociceptive stimulus, you have what we call the onion effect. So there is so many things that affect that signal process. before it gets actually sent back out from the brain. So you have what I like to call the security guards at the level of the spinal cord, basically either blocking or allowing the signal through. And if they allow the signal through, then it has to go up to the brain, it has to get processed. And if there's negative thoughts and beliefs, it can actually amplify the signaling a lot more. You have social and environmental factors. So all these things play a important role when we're looking at managing persistent pain. And this is some good literature that sort of outlines that. So this is basically just demonstrating that the more you think about your pain, the more you will feel pain. The less you think about, the more distracted you are from your pain, the less you will feel pain, both in intensity and how unpleasant it may feel. And also emotional modulation, which is the more bad mood you, or the more bad moods and negative emotions you feel, the higher your pain levels be and the more unpleasant they will be. And on the opposite side, the better your moods are, the less intense and less unpleasant your pain is. And that's evident sort of in with, for example, with sports players, they're doing an activity that they really like, they sustain an injury, and they don't really notice the pain until afterwards. So when they're happy and they're having a good positive experience, they're distracted from the pain, they don't experience as high level or as unpleasant of a pain. So in summary, basically there is six key concepts of pain that I wanted to really discuss today. So as we discussed at the beginning of the PowerPoint, pain is always an output of the brain 100% of the time. So it's always an output of the brain rather than what goes in to the brain. It's what the brain sends out, that's what you feel as pain. Pain does not equal the amount of tissue damage. So some people can have high tissue damage and low pain, and some people can have low tissue damage and high levels of pain. So tissue damage does not correlate to the pain that someone is experiencing, both in intensity and the unpleasantness of it. Pain is influenced by multiple factors, such as thoughts, so activities, moods, and stress, which can amplify or increase the level of pain that we feel. Acute pain serves as a useful protective function to warn of danger and injury. So it's a positive experience. However, chronic pain is the result of a hypersensitive nervous system and usually no longer warns of damage. So basically, you might have an area that was once injured that is now healed up. However, this hypersensitivity of your nervous system still activates the pain signaling. Many treatments can help turn down the hypersensitive nervous system and reduce pain and improve quality of life. And we'll get into what some of those treatments are in the case study. So we can start off. So the patient X, let's call him patient X, he's given me permission to share his information. So he was a 43-year-old male presenting with lower back pain, radiating pain down the leg following an injury at work, and he was diagnosed with fibromyalgia in 2021. When he first came in, he was on high doses of pain medication following his diagnosis to manage his pain. So that was his main treatment strategy when looking at managing his pain. Some of the impairments that he had, so we won't get too deep into it, but basically he was unable to stand for long periods of time because he couldn't put weight on one of his legs. He couldn't bend forward basically at all to pick anything up off the floor or even just a slight bend forward. He was unable to walk because he had weakness in his leg from avoiding using it due to the pain. So how does that sort of link to the activity limitations? He couldn't sit for longer than 5 minutes, standing for 2 minutes, walking for 2 minutes at a 1.6 kilometer an hour speed. So average human walking speed, adult human walking speed is about 5.2 kilometers per hour. So he was basically walking at an extremely slow pace. Bending forward was highly limited, and carrying was limited to very light tasks. So all in all, he had significant functional restrictions. And we all like to think about, okay, we can't use a certain part of our body as efficiently, but we tend to sort of look over how that can relate to our life. So, he was unable to do household chores because of his pain, and he liked his social gatherings, barbecues, which he was not able to do, cooking, and he liked exercising, and he was a handyman at home, was unable to do any of that, attending sports with his daughter. His daughter played fairly high level netball, and he was unable to be a part of that, and rugby throws with his children. So these are some of the things that he was unable to do when he was initially diagnosed with fibromyalgia. And why is this important? So why are some of these participation restrictions important? And basically, if you have a look at the chronic pain cycle, you have anxiety, that pain signals tissue damage, brain becomes more focused on the problem, changes take place in the nervous system, then you start feeling more pain, more anxiety and less movement, more changes to the nervous system. And this basically enters you in this vicious cycle of persistent pain. And where these activities might make you feel better and have the opportunity to break this cycle, because of our functional limitation, he basically felt useless and worthless, some of the words that he used, because he was unable to participate with handyman work and chores around the house and helping his wife with the cooking and being a part and a supportive father figure to his children. So all of these things contributed to his life greatly, and therefore contributed to some of the negative moods. And as we know, the more negative emotions and negative moods that you may have, the higher the pain level. So again, this sort of fuels the chronic pain cycle, the persistent pain cycle. And this is the approach that we took. So biomedical versus biopsychosocial. And when I refer to biomedical, I'm mainly referring to the management of acute pain, which is generally the approach that we see in a general physiotherapy practice. So when you go to a general physiotherapy practice, generally they will start this biomedical approach right away. And the biomedical approach involves some strength exercises, perhaps some range of motion, coordination, maybe some pain management through those exercises. They might increase the weight that you're doing or the things that you need to do day to day. They might do some passive strategies, which involve mobilization of the joints or massage, maybe some trigger points, hot packs, some sports creams and things like that, right? But what this approach overlooks is the psychosocial component to managing pain. So we took a little bit of a different approach, and we basically went more down the psychosocial approach. And we implemented pain education, which is basically what I've introduced to you guys today. We've introduced SMART goals and weaning off pain medication. We did have the bio component still, so we did the strength and the stretching and the function, but we also implemented coping strategies, self-management, making sure that there was a routine, reducing reliance on any aids, and that includes any braces, knee braces, lower back braces. And I think the big thing is that we also implemented relaxation, mindfulness, thoughts management. And I'm sure that some of you may have already covered that with MoreGoodDays, but that also plays a large role in managing persistent pain. And then some other lifestyle choices like improving nutrition and reducing or stopping smoking. So basically, the way that we approached the exercise component of things is we introduced an exercise routine that he was able to tolerate, and then we gradually built up on that routine. And the routine was very specific to his goals. So we implemented things like rugby throws, things like going for longer walks, increasing his standing tolerance, all of the things that he needed to be able to achieve these goals here. So some rugby throws, standing tolerance, even doing some forward bending type exercises to be able to help with household chores. And basically we ended up continuing that over time and building upon that routine. Now, for everyone, they're going to have a different approach. So everyone's very different and unique and has a unique set of goals. But our approach was we found a level of activity that he was able to tolerate at that point, and then we gradually built up his intensity and the amount that he was doing with the exercise in a gradual fashion. So he was able to tolerate the changes. And these are the results. So again, I have permission to show this video, but these are the results after 12 months of physio intervention. So he started running. We have him doing some weighted squats. And remember, this was someone that basically was unable to stand or walk. We have him doing some floor-based Pilates core strengthening exercises. And that's a 15-kilo kettlebell with a forward bent position. So that's a little short video of what he was able to achieve by implementing the biopsychosocial approach. And he was able to go ahead and start going back and being a part of his children's lives. That made him feel better, and it sort of enabled this positive cascade, and that also then went ahead and contributed to managing his pain. So it wasn't just the exercises themselves, but all these other factors that were targeted throughout the process. Just doing the exercises alone and pushing through the exercises, and I think limits the way that we can manage persistent pain. I think we can do so much better and we can achieve so much more by looking at it from a wider angle. These are the references that I used throughout today's study. So everything is literature reviewed, but if you have any questions about anything specifically, I'm more than happy to chat to you via email and send some of these through. And now hopefully you like today's presentation, but now we'll get to the questions, the Q&A part. So Sonia, I'll let you take it away.
Right. So we had a lot of questions. As I mentioned to you earlier, we had about 140 people actually register, and quite a lot of those people submitted questions. We won't have time to address them all, but the one that really stood out is one that's sort of a fairly general one, is what is the best type and level of exercise for fibromyalgia? Is it hydrotherapy or swimming? What about yoga and Pilates? What about other kinds of exercises, bike riding, weights, those kinds of things?
Yep, awesome. So really, there's no one size fits all. I always like to encourage everyone to do the exercises that they enjoy the most. And second to that, do an exercise mode that's going to be closest related to their goal. So if their goal is to go on a short hike, then perhaps we can begin with increasing walking tolerance. If their goal is to reintroduce swimming, then entering a swimming pool and coming up with a little bit of a swimming routine will be a part of that exercise program. I always like to encourage people to add a resistance training component, just because it closely mimics what we do day to day. So if you think about mowing the lawn or carrying shopping or sitting up and down from a chair, all of these things require a resistance component and can be almost turned into an exercise and added to a routine. So when you are faced with some of those tasks in day-to-day activity, your body and your nervous system is quite used to it and prepared to handle it, which in the long run leads to reduction in flare-up amount, because now your body is able to tolerate that workload.
Lovely. Another question that came up a couple of times was, will muscle stimulation machines like Embody or those kinds of machines actually help, or do we have to actually do the work ourselves?
So there is a place for muscle stimulation machines, but I always like to think about how we can wean off those machines in the long term, because we obviously don't want to be confined or limited to machines. So if you think about daily life, you want to be able to do these activities without relying on any type of external sort of stimulants. However, they do have a place, and usually that place is in the beginning or the initial stages of recovery, where we can use these machines as a stepping stone to then increase the amount of exercise or introduce exercise. We can also use them to reduce some of the pain medication. So we can perhaps use these machines as a tool, but in the long term, I think to always have in the back of your mind that the long-term goal is to become independent of these passive strategies, that where we don't need to rely on them, and we can manage our pain and discomfort through other ways.
That sounds good. You sort of did mention it with your case study about your patient that increased the amount that they were able to walk. But how do you increase the number of steps that you can walk daily without actually increasing your fibromyalgia pain?
Great question. So the key to increasing exercise tolerance is to make sure that we start at a level that doesn't change our symptoms, no matter what level that is. So if your tolerance is 5 minutes and that's what you can handle, that's where we start. If your tolerance is 2 minutes, if your tolerance is 10 minutes, we start at not only the duration, but the speed that you can tolerate. So with patient X, his initial tolerance was 1 minute at 1.6 kilometer speed. And that's where we started. And over the course of weeks and weeks, we gradually built up that tolerance. So we looked at increasing the time first by half a minute to a minute every week to 2 weeks, and gradually building up how much he was able to do. Once he was happy with the time, then we started looking at the speed. So again, it's closely related to the goals, but he ended up running at a 6.5 kilometer speed towards the end. So we basically gradually built up. And of course, we use pain and discomfort as one of the measures. If we find that it's aggravating our symptoms, we can simply lower the speed or lower the time of the walk. And if we find that we're tolerating it well, we can simply increase and adjust.
Right. One thing, I'm going to pop you on the spot for a moment and ask a question that we hadn't asked in advance. Can you talk a little bit about why movement is so important?
So in our day-to-day function, we require movement with everything that we do. And unfortunately, with the persistent pain presentation, it limits the amount of movement that we can do. And basically, over time, it leads to something called deconditioning. So we end up being able to tolerate less and less and less and less. And if we tolerate less and less movement, that means the onset of pain comes a lot sooner. And movement is really important because it holds that onset off. But if we can build up onto the amount of activity we can do, we can actually extend the amount of work we can do, or the amount of activity we can do on a daily basis, before we have that onset of pain. And that ultimately reduces the amount of flare-ups and reduces our pain overall.
And I guess we've just talked about the importance of movement. Would you mind running us through a really simple movement break? We've all been sitting for half an hour.
Yep, perfect. Yep, awesome. So we can do I don't know, if you want to grab a glass of water. I know I'm going to have some water. I'm feeling parched. Have some water. One of the movements that I find works really well, particularly when you're sitting behind a desk for so long, is just doing some shoulder retractions. So just squeezing some of the muscles in your back as much as you can tolerate. I don't really like the whole rolling forward and back. I think that majority of the muscles in the front here are already active by sitting down for too long. So just some gentle squeezes back. Nice deep breaths as well. You don't want to be holding your breath. And then we can go reach for the sky. That also helps with some of what we call thoracic extension. Nice deep breaths. For those that can't reach for the sky, if you have any type of shoulder pain, you can do some shoulder raises instead to the side, as far up as it can go. Perfect. And then the next one, we can do some rotation. So you can use the side of the chair or your thigh and just rotate over to one side, just as far as you can go. Some nice gentle breaths. And then switching sides. And if you have a backrest or a chair with a backrest, you can lean slightly over that backrest. Don't lean too far back. Couple there. And we can do reach across the body. Last one. And switching sides. Nice and loose. If someone wants to do some standing ones, feel free to go for a little bit of a walk. But generally, this is sort of the movements I implement when I'm having a long day behind the office. I like to get that upper back and thoracic spine moving and prevent sort of some of that stiffness in the upper back.
I don't know about everyone else, but I certainly feel a bit better after that. So the next bit, we'll sort of get into a little bit more about that flares. How do you find that sweet spot of doing the right amount of exercise without ending up in bed? We've got a few people who are pretty much, I mean, like I was when a few years ago, pretty much bedbound and managing to get from the bed to the couch, and that's about it. How do you get from there to doing some more movement without triggering a flare?
Yeah, very good question. So I think the initial stages of establishing a baseline is the trickiest thing when managing persistent pain, because it does take a little bit of trial and error. So oftentimes I like to ask the question of how much are you already doing now? You know, can you walk to the letterbox? Can you pick up a jug of milk? Can you, sit for X amount of time? So some of the things that you can already do now, and then I use that dosage or that tolerance to establish the first draft of the exercise program. So if someone can pick up a 2 liter bottle of milk, then I know that their lifting capacity in that plane of motion would be, 1 to 1.5 kilo. So there is a little bit of estimation that takes place. Or if I know someone's walking tolerance is 5 minutes, or even from to and from the letterbox, for example, which can be 20-40 minutes, then 20-40 meters, then that's where we start off with our baseline, and then we slowly build up on that. Now, if majority of the time you are bedbound, there are things that we can do in a laying position that are gentle and light and still encourage movement. And then from there, we can sort of break away into introducing one standing exercise example, and then slowly adding towards that. But basically, the key thing is that you want to start off where the baseline tolerance is currently and work your way up from there.
So really meeting ourselves where we're at, not where we want to be.
Correct, because if you start off at a level that's above your current tolerance, that's just going to lead to a flare up, and we sort of end up going around in circles in that case. So you want to be able to start off what you can or where you can currently tolerate, and then build up from there.
Lovely. And that sort of answers a little bit of the next question is,
Mhm.
should you keep doing an exercise if it's causing you pain?
Very good question. So the answer is yes, but to a degree. So if your pain increases, let's say a 1 out of 10 above where your baseline is. So if your pain is currently a 5 out of 10 and it goes up to a 6 out of 10, and it stays there for 1 hour, 2 hours, and then it sort of settles back down, I'm happy with that. Some literature even suggests that it's okay if your pain increases for 24 hours. But I like to, particularly in the initial phases, which is probably where we'll be asking this question the most, I like to be a little bit more conservative. So if the pain is there while you're exercising, and as soon as you stop, it kind of goes back down and you can control it really well, then I'm happy for you to continue on. But I find that if the exercises are creating pain where they're, you know, making you bedridden and ruining the rest of your day, or the following day, or sometimes even multiple days, then we know, okay, we've probably overdone it and we've exceeded that baseline. And what we need to do is we need to cut back on the amount that we're doing. Um, and I think coupled with that, we need to look at, you know, what other activities we're doing that day. Because if we start an exercise program and on the same day we're doing mopping, shopping, mowing the lawn, and doing other physical activities, that will contribute to the total load in that day. And sometimes that might confuse or mask the idea that the exercises are too much. So I think that doesn't just contribute to the exercises themselves, but it contributes to the total amount of activity that you're doing in a single day.
Yeah, that's great. I guess the rest of this question is what about when the pain comes on later? If it's not actually happening while you're doing the exercises, how do you know when to stop if the pain doesn't come or the fatigue even doesn't come until much later?
Are we talking within a 24-hour time frame, or are we talking weeks or a
Oh,
week?
there was questions about all
Okay.
of them, to be honest. So
Okay,
a bit of a
perfect.
general advice would be good.
Okay, perfect. So if it's coming on, let's say the following day, and there was no activity between the exercises and when the pain starts, then the first thing that I will do is start assessing the psychosocial aspects of pain and not straight away lean to the bio component of pain. If we do an activity and it flares us and it doesn't flare us up, then it's less likely that it's due to that activity and more likely that it's a component of the other factors. If it comes on, and basically the further along that goes, the more likely that is to be the case, particularly if you've done exercises consecutively. So if you do exercises today, tomorrow, the next day, and you're feeling fine, and then day 4, day 5, the pain starts ramping up, I would start thinking about the other factors rather than getting straight to looking at the exercises and modifying the exercises. If the exercises are the ones that are aggravating your symptoms, it's more likely that they would happen right away or within a 24-hour time frame.
That's really good to know. How do we continue to exercise when we just don't have any motivation, or we know that there is likely to be, or we're frightened that there's likely to be some pain or fatigue that's coming on? How do we get that motivation? Do you have any advice for that?
Yeah, perfect. So I think that goes back to the first question that was asked, and that's doing activities that you enjoy most. You know, there's real two ways of looking at it. You can either choose an activity that's difficult and be highly motivated, or choose an activity that you love and that's easy to do and still gets you great results and not need to worry about the motivation side of things because it's you're going to enjoy doing it. And exercise doesn't have to be 5 times lifting something 3 times a day and this structured routine. Exercise can easily be something that you enjoy doing. For example, with patient X, one of his exercises were rugby throws with his son. So we incorporated some rugby throws and we were able to add that to his exercise routine. And that was an activity that he really enjoyed doing. It was part of his goals. And, you know, he didn't really need much motivation to be able to do that. In regards to the fatigue side of things, now that's relatively tricky. So fatigue, if you have high levels of fatigue, then we actually don't encourage to push through the exercises. So when you do have high levels of fatigue, we want to adjust the exercise level to your current tolerance. That might mean reducing the amount of repetitions you're doing or the amount of rotations that you're doing. That might mean pacing the exercises out and spreading them out throughout the day, for example, and basically making the exercises a little bit easier to do during those periods.
Is the last bit of this section is how do we know if it's just our fibro pain or if we've actually injured ourselves? Because obviously if we've injured ourselves, we want to stop, but how do we tell the difference?
Perfect. Very, very good question. So basically that sort of goes back to what we were talking about within the presentation in that nociceptive pain, which is the acute painful response, is generally has a very clear and distinct pattern. So if you do a specific movement, it'll aggravate your pain, and if you don't do that movement, it basically won't aggravate your pain. So there's a specific presentation, and that's one of the ways. And the other way is that if your pain increases drastically with activity. So if you're doing a specific type of activity to let's say an injured tendon or a fractured bone, you're going to have this instant spike in pain that's going to be related to a specific movement. But it's very hard to be able to tell that on your own. And I think that that's where you would want a clinician to be able to do specific tests for those specific types of injuries to either rule them out or rule them in and make sure that it's safe for you to continue exercising.
That's a perfect segue into our last question. And
Yep.
we had, this is a sort of an amalgamation of an awful lot of questions. We had a lot of questions from people who have specific injuries or weaknesses to upper and lower backs, to knees, to hips, to shoulders, to hands, to pretty much everything as per the nature of fibromyalgia. But what advice can you give to people who have injuries or weaknesses that they do want to address with movement or exercise?
So basically, sort of recapping a couple of the questions. I think the best thing is if you have multiple areas that are sore, then you would want to do exercises that involve as many of those areas. But again, you want to make sure that you choose a specific load tolerance that or specific baseline before you start increasing your activity. So making sure that that initial baseline of activity is there and you're able to tolerate that. And that might mean that there's going to be a difference between these areas. So it might mean that initially it might be more challenging for you to do any type of forward bending activity, but for arms it's quite easy for you to do, and adjusting to those parameters and those baselines is what's going to get you the best sort of widespread result. I hope that answers your question. That was a tricky one.
It certainly was a tricky one. And because there were so many questions, anyone who's watching the recording, or if you were one of the people who asked those questions, I'm sure you can appreciate that Milos can't possibly know your history, what's happening with your body and what's happening with your specific injury. But he is available for consultations. So I'll just invite Milos to have a bit of a talk about how you actually can make a consultation with Milos and what benefits an online physiotherapist can have, because that's something I definitely struggled with before I started seeing Milos as a patient. I'd always thought of physiotherapists as being this hands-on acute injury approach sort of thing, and I'd really like to invite Milos to explain how he can help us.
Yep, perfect. So I've just got some of my contact information on which I'll share. So basically, you can reach out to me at info@onlinephysical.health, and the website is onlinephysical.health. Now, I think the biggest thing that we monitor at Online Physical is, or how online physiotherapy is beneficial, is that we can monitor all of our exercises online. So we have an app where we monitor everything. We monitor pain levels, we monitor the amount of reps and sets that you do, and we can gradually sort of be able to not only look back to the past, but also determine how much to progress in the future. So we have this constant monitoring process. And I think with persistent pain management, that's really important, because it's these subtle changes that compound and add over time that you see the best results with. Almost like if you jump in a little bit of an analogy, if you jump in a warm pool and you gradually reduce the temperature over the course of weeks and weeks and weeks, you're probably not going to feel the change in temperature as much to if you were to jump in a warm pool and then straight to a cold pool. So I think the monitoring process to exercises are very underutilized with treating fibro and other persistent pain presentations. The less changes there are, and it makes it a lot easier for our body to adapt. So that's one of the big benefits. And secondly, we really encourage self-management. We know that persistent pain, particularly fibromyalgia, is a long-term thing. So we're looking 12 plus months, 16 months. And if you're constantly having to see physios to have hands-on relief, it's just not sustainable. You have to go sometimes even multiple times a week just to have pain relief. And it's how long are you going to do that for before it just becomes unsustainable. So I think we manage, or we approach it from a self-managing approach where we encourage everyone to learn the skills, or I basically teach everyone what I know so they don't need a physio. So to learn the skills that's required to manage your pain, because that's when we can do it for the longest amount of time, and that's when we'll be able to see the best results. Yeah, so we do face-to-face consultations as well. So we can have face-to-face sessions on what to do and what not to do, and delve a little bit deeper into some of the pain management concepts. So that's an option that we have also.
We do also have some international registries for this webinar. Can you share what countries you're able to see people from, please?
Anywhere but the US. So the USA, if you're based outside of the USA, that's A-OK. If you're based inside of the USA, we're unable to provide services.
Thanks.
Awesome.
Yeah, we will also send that contact information out with the replay information. So if you didn't get a chance to write that down, don't worry, it will come in the email. I'll talk a little bit about MoreGoodDays. I've seen some familiar names and faces, so I know that there are some past and current clients with us today, but there's also some new names that I'm not familiar with. So as I mentioned at the start, in case you missed it, we are an online pain management program, and we go through a lot of the things that Milos went through today. We have a biopsychosocial approach to pain management, and we teach you what fibromyalgia is and why it is you have so much pain without necessarily having something show up on a scan. We look into those various ways of turning those dials back down again, the stress and anxiety and the grief and all of those psychological and social aspects that Milos mentioned as part of our program. From a personal point of view, I went from being virtually bedbound, mostly housebound, but regularly stuck in bed or just being able to get from the bed to the couch. Now I work, I walk regularly. I'm regularly seeing Milos to have my exercises increased and changed and based on my goals that's happening at the time. And overall, I'm doing much better with my fibromyalgia. I still have it. Unfortunately, there is no cure. We don't claim to be able to cure it, but what we aim for is better management so that you can have a good quality of life, because ultimately quality of life is the most important thing. And while we can't take your fibromyalgia away, and I wish we could, both for you and for myself, we do aim to be able to improve quality of life. So if you're interested in signing up, we have a few different plan options. In the email that will be sent out, there will be a link that you can book a time with myself or a different support coach to have a chat to you about your specific needs and which plans might be best for you. We've got self-guided plans. We've got plans where you have coaches. We have plans where there's psychologists included. We don't have any plans that actually include any appointments with Milos, but we do encourage you to make appointments with him if exercise and movement is your goal and you need a bit more help with specific areas as well. From a personal point of view, he is brilliant. I've very much benefited, even though I had already learned to manage my fibromyalgia pain in itself. He's really helped me strengthen my body and made it able to do things that it didn't used to be able to do. So thank you everyone. We do have an extra 2 minutes. So if there's anybody who wants to ask any questions, please feel free, whether it's of me or if it's of Milos, please feel free to unmute your microphone and ask a question if you've got one. That's okay. If you think of any questions later, or if you're watching the replay, feel free to reply to that email. The email address is definitely monitored. There's always a person at the other end of that email address. It's not just an auto send. So you'll definitely get a reply from someone if you want to send an email. Thank you so much to everyone who attended live. It's always nice to see people here, and it is that extra effort when you have a chronic illness. So we do appreciate the effort. And for anyone who is watching the replay, thank you also for your time. And especially thank you, Milos. It's been been a really good session.
Thank you everyone for investing time and sitting through the webinar. Hopefully I answered some questions and provided some additional information. And yeah, good luck with your journey. And I hope you achieve all the goals that you want to achieve. If you need anything, I'm always available. You can always reach out. But yeah, thanks once again.